Hello and welcome to our keynote event in our series, Those Who Feed Us, a webinar series exploring migrant farm workers, health disparities, and digital inclusion for better health. I'm Jamie Bloss, and I work at East Carolina University's Laupus Health Sciences Library. I'm the liaison librarian to the College of Allied Health Sciences and the School of Dental Medicine. Before we go any further, I'd like to turn it over to our interpreter for today, Murtado, to explain the interpretation options before we get started.
Hi, Jamie. This is Murtado, the Spanish interpreter. Before I make that announcement, can you set me up as the interpreter really quickly at the bottom of your screen? It doesn't automatically do it sometimes.
Yeah, we should have that in 1 second.
All right, I'll start. So welcome everyone. This message will follow in English for those who are willing to participate in I got it. Thank you very much. For those who want to connect to the language, please, at the bottom of your screen, you will see a little globe like it shows in the screen that says interpretation. Click on that globe and select the language that you want to participate in. If you are bilingual, you do not need to select the globe. If you're connecting from a tablet or a smartphone, you will not see a globe. You will see the 3 dots for more than language interpretation. Then you select the language in which you want to participate. Muy buenos días y bienvenidos, bienvenidas a todos los que están aquí con nosotros esta mañana para participar y escuchar este evento. En español, por favor, vayan a la parte inferior de la pantalla, hagan clic en el globito que dice interpretación y elijan el idioma español. Para conectarse por una tableta o un teléfono celular, hagan clic en los 3 punticos, seleccionen el idioma y seleccionen español para escuchar español. No olviden poner terminado para que reciban la información en español. The last comment that I want to finalize with, in order to create a fully bilingual space, this is a work that we will do together, and we want to remind everyone to speak at a moderate pace so that everything you say can be said simultaneously. Thank you very much, and back to you, Jamie.
Thank you so much, Murtado. We really appreciate it. So our event today is Digital Inclusion for North Carolina Farm Workers in a Pandemic, Lessons for Implementing and Promoting a Sustainable Internet Connectivity. We hope you'll join us for our second event, a film screening and discussion on October 27th at 10:30 a.m., and a third event, which will be a panel discussion on digital inclusion and health outcomes on November 3rd at 10:30 a.m. You can sign up for the upcoming events on our website at hsl.ecu.edu. We'd also like to thank our partners from the Laupus Health Sciences Library Diversity Committee, the NC Farmworker Health Program, the ECU College of Health and Human Performance, Student Action with Farmworkers, and the NC State Agromedicine Extension for arranging and hosting these webinars with us. These partners are in their 3rd year of working together with support from the National Library of Medicine to improve the daily lives of migrant and seasonal farm workers by expanding internet connectivity and access to online health information. Now I'm going to read the North Carolina Land Acknowledgement. We acknowledge the Tuscarora and Catawba people who are the traditional custodians of the land on which we work and live. We honor these tribes by recognizing that our institutions were built on land stolen from those who were here before colonizers arrived. We pay respect to 8 recognized tribes: Kohari, Eastern Band of Cherokee, Haliwa Saponi, Lumbee, Meherrin, Occaneechi Band of Saponi, Saponi, and Wakamasuan, all nations, and their elders, past, present, and emerging. Additionally, this land has borne witness to over 400 years of enslavement, torture, and systematic mistreatment of African people and their descendants. We must acknowledge the history of our spaces and the places that we occupy to both understand and unlearn the many ways that we have been socialized. A few tech considerations for you today. As you can see on the image shown, you have the ability to ask a question in the chat box located either at the bottom or the top of your Zoom screen, depending on which device you're using today. Your chat will be sent to everyone, panelists, moderator, and attendees. And as Murtado said, the language interpretation will either be a button next to the chat button or located by clicking on More and the 3 dots. You can exit the webinar by clicking on the red Leave button. And we also wanted to note that the session today is being recorded, but we'll stop the recording during the Q&A section of the event. Now I'm going to go ahead and introduce our keynote speakers, both of whom I've had the pleasure of working with over the past 2 years on our National Library of Medicine grant and on creating outreach and education resources. First, I'll introduce Dr. Leslie Cofie, who's an assistant professor in the Department of Health Education and Promotion at East Carolina University, where he has been a faculty member since 2018. He completed his PhD at UNC Chapel Hill Gilling School of Global Public Health. He received both his MA in medical anthropology and his MPH from Case Western Reserve University. The core of his research focuses on understanding and addressing the root causes of health inequities experienced by vulnerable populations. Dr. Cofie uses both qualitative and quantitative research methods in developing, implementing, and evaluating a range of health issues. Most recently, Dr. Cofie has been a co-investigator on a National Library of Medicine grant to address migrant and seasonal farm worker health, working on training, research, and evaluation with migrant worker populations and community health workers. He also serves as the evaluator on 2 projects aimed at improving digital connectivity, health literacy, and access to telemedicine among migrant farm worker families in North Carolina. A project led by ECU's Laupus Health Science Library that provided laptops to migrant farm worker students in Eastern North Carolina, and a North Carolina farm worker health project providing internet access such as hotspots and internet hubs in migrant housing across the state. We also have with us today Natalie Rivera, who is the Internet Connectivity Project Coordinator at the NC Farmworker Health Program with DHHS in the Office of Rural Health. Natalie coordinates a sustainable initiative to bring internet to migrant farm worker housing across North Carolina. The goal is to support the well-being of farm workers by bridging access to telemedicine, social outlets, emergency communication, and educational resources through internet connectivity. Prior to working with NCFHP, she launched one of their grant-funded farm worker health outreach sites in Eastern North Carolina, where she served as the program director and outreach coordinator for over 7 years. She has experience working at 2 Latinx-led nonprofits through both AmeriCorps Access and Student Action with farm workers. Natalie completed her undergraduate degree at the University of North Carolina, Wilmington, and received her master's in public health from the University of North Carolina, Chapel Hill. Natalie grew up in rural North Carolina and has a passion for the outdoors, including camping and hiking. So it's my pleasure to welcome you both today, and I'm going to turn it over to you now, Leslie and Natalie, for your keynote.
Thank you so much, Jamie. Just get the We'll go ahead and go over a quick overview of the presentation today. First, we're going to, of course, talk about who are farm workers, their central role in agriculture in North Carolina, We're going to talk about the North Carolina Farmworker Health Program, what we do in the state to help reduce barriers to healthcare for farm workers. Of course, we'll talk about the Internet Connectivity Project, implementation, evaluation, and strategies for sustainability. So as I go over a little background with Internet connectivity, we're going to show a brief Facebook video of a El Compañero 509, who frequently posts videos of farm workers and kind of showing what they do. And if you want to learn more, you can follow him on Facebook. But who are farm workers? I'll tell you while this video plays. Yeah. So farm workers have an essential role in agricultural production. As you can see in the video, 85% of fruits and vegetables in the US are hand harvested, particularly in North Carolina. Tobacco and sweet potato are the top hand harvested crops, and North Carolina is 6th in the nation for the number of farm workers. In North Carolina, there are an estimated 72,000 farm workers. According to NCFHP patient data, 99% are Latinx, Hispanic, mostly male. 98% speak Spanish with limited English proficiency, and 10 to 15% of workers have indigenous language as their primary language. 99% are below the 200% federal poverty line, and 93% are uninsured. We categorize, or we look at farm workers as seasonal or migrant. Seasonal farm workers do not move for work. They're more likely to be a family living in the same area year round, and then they may do other work in the off season or not work at all. Migrant farm workers move for work, can be from state to state or from country to country. For example, we have 55,000 migrant farm workers in North Carolina during peak season. Of those, about a third are H-2A farm workers that come from primarily Mexico or Central America to work during the contract season and then return. So farm workers experience inequity. We're going to switch screen sharing. So Leslie's going to, we'll switch, share, go back here. It'll just be easier this way. All right, hopefully you're seeing my screen. So farm workers experience inequities. So for example, agricultural exceptionalism is an example of that, limited employment rights. So only H-2A farm workers and farm workers on a farm where there's 10 or more full-time employees are actually eligible for workers' compensation. And then with the nature of work, farm workers work very long work hours, sun up to sundown, 6 or 7 days a week. They also don't qualify for things like PTO, paid time off, sick time, vacation time, or in most states, overtime pay. And then with the migrant housing, so migrant housing is where it's grower provided housing. In North Carolina, according to the Department of Labor, there's almost 2,000 registered migrant housings in the state. And that's where most of the migrant farm workers will live during the season while they're working on the farm. According to a Wake Forest study, at least 40% of those migrant housing units were set in a location that was considered hidden or set off the road. And they're also typically a barrack style, being metal or concrete, and many of them house 21 or more workers. And I'll talk to you more about why that's an issue with broadband a little bit later. Moving on to healthcare access. So agricultural work is consistently ranked among one of the most hazardous industries, specifically occupational hazards being pesticide exposure, heat stress, illness, musculoskeletal issues, just to name a few. And then chronic conditions like diabetes and hypertension are often prevalent as well in the work we do with the NC Farmworker Health Program. The nature of farm work also makes it difficult to manage those chronic conditions. So working long work hours, obviously taking medications, eating the right types of food, just makes it even more difficult. And then there's a higher risk for spread of infectious disease due to the congregate housing that was mentioned before. Other barriers that farm workers face: language barriers, transportation, location, cost of services, cultural barriers, and then now we're talking about internet connectivity. What do we do as the North Carolina Farmworker Health Program? We're a statewide migrant voucher program. We work with gaps in coverage all over North Carolina and support 8 health outreach programs to provide outreach services to farm workers. This is a picture, for example, of an outreach worker providing services, direct services, doing health assessments, also helping with the barriers I mentioned before. They might go and provide transportation to the clinic or interpretation. And that is how we've been able to help reduce those barriers. Now with the COVID-19 pandemic, our role has really evolved and we're still learning a lot from it. We're doing COVID response now all over the state, supporting over 100 counties with vaccination events, also working on protocols, health education around COVID-19, as well as distributing PPE. And our partnership has really expanded to all the migrant health centers and local health departments and extension offices. With the with internet connectivity, with the COVID-19 pandemic, our role in addressing the digital divide has also changed. When the COVID-19 pandemic started, we were very concerned with contact and reducing the spread of COVID-19. So we're outreach workers, we're usually out in the field. We were trying to find a way to support, at the least, virtual outreach through internet connection. And we used CARES Act funding. Well, the idea was to use CARES Act funding to purchase MiFi hotspots. Well, first we ran into, before we could get started, we had some project initial challenges. And first was that there's no one-fits-all solution. So with internet connectivity, there's different types, right? There's cellular connection, there's fiber, cable, DSL. There's also various internet service providers to choose from. And broadband infrastructure in rural areas is also limited. I mentioned before, this is a picture of some migrant housing units, kind of an overlook of them. Mentioned before some of the challenges being location. These particular migrant housing units are set off the road in a hidden location. They're a metal structure, and there's about 75 users that would need, 75 farm workers that would need access to the internet. So it really creates a unique challenge with even bandwidth and cost, and just the signal being impeded by the structure. Finally, just logistics of implementation was really challenging with short-term funding and emergency situation. We really wanted to get input as we were implementing a new intervention. And we also had some challenges with our procurement and contract processing that was also difficult to move quickly. So I'll tell you what we did with the Internet Connectivity Project. Our main target audience was farm workers gaining access to the internet. And secondly was health outreach partners being able to virtually reach farm workers. Then it was collaborating with partners for additional resources, models, and support. And finally, thinking about sustainable internet being digital equity inclusion for farm workers. So the three different sort of methods or resources that we came up with to support farm workers with internet access. The first was a contract with the North Carolina Agromedicine Institute for a migrant housing internet connectivity reimbursement / cost share program, where growers could actually set up internet connectivity in migrant housing, such as fiber or cable, and they would be reimbursed up to $1,000 per migrant housing unit for setting that up. And it also covers the service fees. And then the second resource has been our outreach partner hotspot lending program. So outreach partners, health outreach workers would deliver MiFi hotspots directly to farm workers, and it's ideal for a situation where there isn't a wired fiber connection, but only a cellular network connection, and ideal for smaller groups of farm workers, just because of the capacity of the hotspot. And then we've piloted an internet connectivity hub, which is for locations like the one I mentioned earlier, where there's maybe 70 workers in one location, and it's a large rugged router that can serve that many farm workers in one area, and that came directly from our office. And I want you to listen, I'm gonna take a minute to listen to a podcast recording that the NC Agromedicine Institute put together, and this is from participants who experienced the hotspot lending program. So if you wouldn't mind, Leslie, go ahead and playing that. I don't hear it yet.
That's because my mic was off.
Ah, okay. Try that again. Thank you.
I'm Hector Alfaro. I'm a worker, and I come to North Carolina to work. I'll be in North Carolina for 6 months working, and I'll be sharing my experience with the Internet project. Since last year, when we requested it, it helped us a lot. We've been able to communicate with our families. We haven't even been able to buy our plane tickets to go back. It has helped us a lot. I'm very happy with it because now we can speak with our family We can even see them now. And well, I'm very happy with the internet, and I'm thankful for the ladies that requested it for us. When we didn't have the device, we almost never spoke. And now that we have the device, we can now speak almost daily. Well, we didn't get very much signal here. There's days that we got good signal, and there were days that we did not. We couldn't communicate with each other, and now we can communicate with them. Now there's times where we can speak to each other every day. We can look for tickets now where we want to go, because before we couldn't, and we'd have to go around asking to look for airplane tickets. And now we can see now with the cell phone. Just to tell you, my son is going to travel to Mexico, and so we were looking for somebody to take him to go buy the airplane ticket, and that was a challenge. And now we can talk with that. My name is Jose Antonio Hernandez. I am a farm worker from North Carolina, and they have provided us with internet, and we were happy because we would always be struggling to talk to each other. We wouldn't have signal in our cell phones. Now with this, we can call and make video calls and everything. Well, now we are more in contact with our families. Almost we're never here. We spend most of our time working. We come home late, we bathe, eat something, and well, it's already night. It's already late. We spent a little time talking, and that's it. Yeah, and before we didn't. We had to go out to look for signal, and we saw a bear today, a big bear. And would it be possible for us to get internet? This is all a necessity. It's a benefit of the device, benefit for everything.
Thank you. Yeah, thank you. That was just a quick interview of farm workers using the Hotspot Lending Program. I'll move on to our support for virtual health outreach. We realized very quickly that our outreach partners themselves needed hotspots to reach farm workers, because they themselves were also in rural areas and sometimes working from home in the beginning. And we also launched a remote monitoring blood pressure equipment pilot project. And then for collaborating with partners to start, one of the initial models we went to, one of the only ones at the time, was the Staff Computers and Connectivity Project, which was an actual project where farm workers were lent laptops and hotspots. So we were able to use a lot of that model to help recreate this, at least the hotspot distribution part. And then the NC Agromedicine Institute sort of already had familiarity with a cost share program with growers. So it was great that they became our partner in doing that with internet connectivity. And then a newer model is the Surrey Medical Ministries, and we're really looking at them right now because they've, in their own county, have done a great job of, as an outreach program, connecting with a local fiber company to promote putting fiber out to migrant housing, and then also wrapping that in with telemedicine. And Rosa Miranda will be doing part of the panel discussion in the third series, who works with Surrey Medical. And finally, the collaboration with local support was super important. Here's a list of all of our partners that are currently distributing hotspots or using hotspots to do outreach and provide services to farm workers. So just a huge thanks to all of these partners. Wouldn't have been able to do this without them. And then finally, for digital resources, while we were providing internet connectivity, we really thought it was important for more digital resources to be available. So here's just a few of the resources that were created or were being created during the COVID-19 pandemic that a lot of our outreach staff were able to push out due to the farm workers having internet. And then finally, I mentioned before, it's a huge priority to get feedback while we're doing this project. So thankfully, ECU came and partnered with us for the project evaluation. And at this point, I will pass it over to Leslie to talk about the evaluation.
Thank you, Natalie. So we were really excited to partner with NCFHP on this project, in part because we've been working on a number of projects related to improving farm worker health. We actually have a number of projects in collaboration with Laupus Library. So we're excited about the opportunity to share with you some of the things that we've been doing. Specifically for this project, what we sought to do in terms of evaluation was to use a process evaluation to monitor and record the approaches that have been used in implementing the project initiatives. We also wanted to determine what this project has been able to accomplish, who were the key stakeholders involved in the project, and also lessons learned that may hopefully help inform similar projects in the future. We use the concept known as the principles of utilization-focused evaluation to help us really gather relevant information on lessons learned to help improve future implementation efforts, and to also gather information to offer actionable steps for our stakeholders. We collected a number of data, which included key indicators from a logic model we developed, and also interviews with stakeholders. We plan on later on conducting an analysis of the phases data, which is basically data collected by the NCFHP to track health services provided to patients, including farm workers. And so we will do that type of analysis later. But for now, I'll go over the data that we've collected so far through the logic model and also the interviews. So in terms of the logic model, we developed a model to really help us determine the reach of the internet connectivity project, and also to the extent to which the specific outputs that we sought out to accomplish had resulted in our intended outcomes. The logic model also allowed us to track the key indicators that we were interested in, such as the number of internet connectivity devices that were distributed to farmers, how many farms were involved, how many growers were also involved in the projects, and so on and so forth. And so in the next slide, what I actually want to do is give you a brief overview of what our logic model entailed. In terms of logic models in general, what this allows us to do is to determine the type of resources we have available to us, and also the specific activities that are relevant in ultimately reaching our intended outcomes and hopefully our future long-term impacts. So for our resources, we were able to identify relevant stakeholders who were important for the internet connectivity initiative. We also identified specific internet services providers that were appropriate for the farm worker camps across the state. And we also identified an important technical support that helped ensure that we were able to distribute the internet connectivity devices to farm worker camps in general. In terms of the specific activities, some examples of the activities that we conducted included the development of the internet services solutions for different farm worker camps. We also were able to create digital literacy videos that were distributed to outreach workers who in turn were able to share with farm workers. And the process evaluation was also an important activity that we conducted from the very beginning to ensure that the initiatives that we were implementing were being effective and ultimately improved upon as we went along. Some of the outputs from this initiative included the specific internet solutions that we were able to identify that have been relevant for various farm worker camps. We received very useful technical support from the NC Broadband Infrastructure Office, which really helped move the project along very effectively. Some of the outcomes that we were able to gain from this initiative include the sustained internet connectivity for farm workers across different parts of the state. We've been able to reimburse growers who took the initiative of providing farm workers with internet connectivities. And also now we do have a library of digital literacy videos that farm workers have access to. So ultimately, we hope that this project would result in a sustained internet connectivity for farm workers in the long term. And hopefully that would also lead to improved health outcomes for farm workers as they now have access to telemedicine, which they are able to utilize. We also ended up forming a North Carolina Agricultural Digital Alliance, which we'll go into a little bit further, but this basically came out of our work with various farm workers serving organizations and also farmer serving organizations that were interested in digital equity and inclusion. In terms of the interviews that we conducted with key stakeholders, well, these key stakeholders included outreach workers, growers, and also farm workers. We conducted the interviews. We actually had an ECU bilingual student who was trained to conduct the interviews. The interviews were audio recorded, and a lot of the interviews have been transcribed so far. Some of the questions that we were really interested in understanding or addressing were from the perspective of the outreach workers, really understanding their experiences in providing health and social services to farm workers before and after the project was implemented. With the growers, we were interested in understanding some challenges in promoting farm worker well-being before the internet project, and also any observed changes they may have witnessed in terms of farm workers' ability to access needed resources after the project was implemented. With farm workers, we were really interested in understanding their experiences in accessing health and social services, as well as maintaining contact with family before and after the internet connectivity project was implemented. Across all of these interviews too, we were really interested in getting a sense of participants' views in maintaining internet access and also any foreseeable challenges that they could think of. In the next slide, I'll point out some of the findings from the key indicators that we've been tracking. So far, we've been able to distribute about 254 hotspots to farm workers across the state. We've been able to establish 14 internet hubs in farm worker camps with a large number of farm workers. 6 growers have been reimbursed for providing internet services to their farm worker employees. And over 3,000 farm workers have consistent access to the internet. The benefit of the internet connectivity project also extended to outreach workers to the extent that they are also able to provide health services to farm workers, for example, through telemedicine. At this point, we have been able to distribute 41 hotspots to outreach workers and healthcare providers. We, as Natalie mentioned earlier, due to access to the internet connectivity in various farm worker camps, we have an ongoing remote monitoring blood pressure study that is being piloted in 5 different sites, NCFHP sites across North Carolina. In terms of the interviews, so far we've been able to collect 8 interviews with outreach workers, 21 with farm workers, and 3 with growers. The interviews are still ongoing. But in the next few slides, I will provide you with information on some of the preliminary findings from the interviews that have been transcribed. Here, I want to actually point out that we've been able to transcribe and analyze the interviews conducted with farm workers and outreach workers. We recently received the audio recordings of the interviews with growers, so we're yet to really examine those interviews. But in terms of the preliminary findings, we identified themes related to the pre-project implementation, after the project implementation, some potential challenges that were brought up, and also lessons learned or suggested improvements. So I'll start with some themes related to pre-project implementations. Overall, most farm working camps had no internet connections prior to the implementation of the internet connectivity project. One farm worker explained, and I quote, "No, I've never had internet here until this time when they offered it." Essentially, most employers did not provide access to internet. So a lot of farm worker camps did not have internet connectivity. There were a few exceptions where farm workers themselves had some access to internet due to being able to bring in phones from their home country. But the issue with this was that the network was not necessarily good, and also it was very expensive to maintain the phone. Farm workers also, on many occasions, actually had to go outside the camp or go to different locations to be able to find some signal to make any type of phone calls or connect to the internet. As one outreach worker explained, and I quote, "They, that is the farm workers, basically have to go up the house and go up a small trail beside the cabin, their cabin, and they go up a mountain, and that's where they get service, and that's where they can talk on the phone." Another theme related to the pre-project implementation was health outreach and services limitation experienced by farm workers. In general, health services and outreach were done in person before the pandemic, but after the pandemic, outreach workers had to find other ways of reaching farm workers, and one approach was to use video messaging. But due to the difficulties in internet connectivities, this was a very big challenge for outreach workers. One outreach worker explained, and I quote, "We are in a very rural area. Even ourselves, we just received a new mobile clinic, and we are like, we have to start using the electronic health records once we go out and everything. But it's like in half of the camps we visit, we have no service." So in general, access and use of the internet, even for mobile clinics in general, were very difficult because of the limited and slow service coverage in a lot of the farm worker camps. In terms of the post-project implementation themes, and one of the themes that we identified was the fact that once the project was implemented, farm workers began to have consistent access to the internet. And in a lot of cases, it actually eased the financial cost of having to use their own phones for making calls or using internet data. One outreach worker explained, and I quote, "They are grateful because that was another bill that they didn't have to worry about for the duration of their time here. I think it helped them financially as well." Another theme also related to health information access. And most of the participants indicated that having access to the internet also enabled them to be able to gain access to different types of health information. That's in the case of the duration of the pandemic, they were also able to gain access to relevant information related to the pandemic here in the US, and even gain access to news back home. One farm worker explained, "You can find information about taking care of yourself, how to protect yourself, what to do, what medicine to take and which not to. Yes, it's truly been useful." Another theme related to medical services access and delivery. And one outreach worker actually provided a really good explanation. And I quote, "When we were offered the hotspots, there was better reception in the camps to carry out the medical video calls. The other service that I didn't mention is mental health, and those consultations are also by video calls with the therapist." So really, as we can see here, health outreach workers were able to expand the different types of health services that they provided to farm workers due to having access to consistent and reliable internet connectivity. Two additional themes that were brought up by participants include the ability to communicate with family members after the internet connectivity project was implemented, and also being able to access educational resources. One farm worker explained, in terms of being able to communicate with family, and I quote, "It helped me communicate with my mother, who is in Guatemala. Sometimes it's so hard to live so far away, but thanks to the service you're giving us, the internet, sometimes even though we're so far away, we don't feel it." In terms of educational resources, another farm worker also explained, and I quote, "They gave us the device and set it up. I was able to take some classes thanks to the internet. And I'm so happy because my girls can now use it for school. The little one is 3 years old and she's going to start receiving remote classes." And so as we can see here, the internet was not only useful in terms of being able to expand the ability of outreach workers in providing services to farm workers, but farm workers themselves were able to benefit from more of a social level in that they were able to communicate with their family members and also utilize the internet for personal improvements such as educations. There were, in terms of challenges in general, we did not identify any major or extremely critical challenge associated with the distribution of the internet technology or the use of the internet devices. But one main concern that kept coming up was the issue related to a lag in internet speed when too many people were utilizing the internet at the same time. So one outreach worker explained, and I quote, "There are camps that are so big in terms of the number of people that I think you have to provide them with at least 2 hotspots so that they can get a good signal." And so in cases like this, when we discovered that there were large numbers of farm workers within a farm worker camp, one approach we used was to basically provide them with more internet, well, to provide them with more hotspots to ensure that more people were able to utilize the internet without experiencing the slow lag in the internet. In other instances too, that we observed that the devices weren't working, we ended up replacing the devices just to ensure that farm workers were able to access the internet consistently. In terms of lessons learned and suggested improvement, participants brought up a number of issues that are important to point out. One included the need for long-term internet access. An outreach worker actually provided this quote, and we just see the disappointment when we say, oh, we don't know if we're able to provide them next year. And this is basically referring to the acknowledgement that this project implementation is basically a 2-year project. And so a lot of farm workers, although they were very excited and pleased with the opportunity to maintain access to internet, they realized that this may not necessarily be a long-term thing. So this really emphasizes the need to continue to really find ways to address this issue of digital connectivity for farm workers, especially those who have historically lacked the ability to gain access to consistent internet. Another issue that another lesson we learned from implementing the project was the difficulty in identifying the appropriate internet service provider for farm worker camps. Although we were able to expand our ability to provide a large number of farm worker camps with consistent internet services, one outreach worker actually pointed out the challenges that still remain in some farm worker camps. And here's the quote: "I know that, for example, at one farm worker camp, one of them is telling me that it hasn't been as effective because with the carrier that we got, which was US Cellular, they have really bad service." And so this is an ongoing issue in some camps that we're still continuing to work on. Some other lessons learned was the included importance of really working closely with partners and coming up with effective solutions for maintaining internet connectivity for farm workers. One outreach worker explained, and I quote, "I think it kind of helps to create relationships with the foreman at the camp, growers if you have to talk to them directly, and even just the people in general. They like the idea of having something to help them connect back home." And so even as we've maintained relationships with stakeholders, we realize that this is an important approach that we continue to need to develop, and also make sure that on moving forward, we find additional partners to work with and coming up with a more long-term solution for internet connectivity for farm workers. An additional lesson learned, and I previously mentioned this, related to really making sure that there are more devices for larger camps. And one outreach worker provided the following quote: "So since things have been so successful, my other suggestion would be to increase the number of hotspots to be able to provide this service." Here, I actually want to point out that one of the internet solution that we've been testing is providing an intranet hub in larger farm worker camps in order to make it easier for a lot of farm workers within a given camp to be able to access the internet without the slow lag that some camps were experiencing. So next, I will pass this back to Natalie to continue with the presentation.
Hey, Natalie, you're muted.
Unmute. There we go.
Gotcha.
Thanks. So digital equity inclusion for farm workers really would mean that they would have access to affordable and available internet, just like any member of the community, and have supporting communication technology and skills to access the information. Equity is looking at all members of society having this access in order to access information, services, and fully participate in society. So these are the things we're thinking about moving forward with what does digital equity inclusion mean for farm workers. Some of our next steps and strategies for digital equity inclusion as the North Carolina Farm Worker Health Program are continue to support, evaluate, monitor feedback from farm workers, outreach workers, and then definitely to do more interviews with growers. We are extending the Hotspot Lending Program through at least December 2022 through other funding. And then also working closely, we're already doing that a lot, working with the Broadband Infrastructure Office and the new Digital Equity Office as well to ensure equitable access for farm workers. We're also really hoping to do more encouraging of local collaboration for farm workers serving agencies with digital inclusion teams, because a lot of the internet service providers or tele-cooperatives are really regional or local, and some of that is just a more local conversation about what's needed, because there are definitely a lot of areas where just need to work more on including migrant housing in the broadband planning. And then finally, just promote the inclusion, I've just said this, of migrant housing and whole farm planning. So we're looking at more of a whole approach because we see how much the farm themselves also needs better internet connectivity for better production. And so thinking about how to include migrant housing when we're thinking about also making sure the farm itself has good internet connection. And with that, we have started, a group of us have started the NC Agricultural Digital Alliance. We actually just met for the first time last week to some of the partners, but the idea is to bring more partners together to think and collaborate over how the agricultural community as a whole can work on digital inclusion and equity and think about shared models and resources and plans for funding. And that is really everything. I'll stop it right there because I saw a lot of questions in the chat. Thank you so much.
All right, thank you both so much for that keynote. We really appreciate it very much. We have a little time for questions now, which we'll try to answer in the order in which they came in the chat. You can keep putting questions in if you'd like. Michelle, if you could stop the recording at this point in time for the Q&A, and I would like to turn it over to